with a great respect and humility, I acknowledge the traditional territories of Lekwungen, Malahat, Pachidat, all the coastal people whose relationship with these lands remain unbroken, with these lands remains unbroken, whose homelands Island Health occupies. It is also my privilege as a guest to make my home on the Lekwungen speaking people homelands in making this acknowledgement, and I commit to walk softly on this land and work to uphold Indigenous health self-determination. So topics for today is we are going to talk about Island Health. As we all know, we are the largest employer on Vancouver Island with diverse locations. We will also talk about specific position, medical laboratory assistant and medical laboratory technologist, more in detail. And we'll also talk about how easy it is to apply to Island Health. We will also let you know on some tips and tricks about how to get your application at top of it, like so that can catch the manager's attention straight away. Yes, so the next topic we are going to talk about is Island Health. As I mentioned, we are the largest employer. As you can see, the statistical information from the slide, over 23,000 staff is currently working for our organization, and we serve more than 850,000 people on Vancouver Island. And we also have over 16 major care centers. So our vision is excellent health and care for everyone, everywhere, every time. Our main purpose is to provide superior health care through innovation, teaching, and research, and a commitment to quality and safety, creating healthier, stronger communities and a better quality of life for those we touch. So our values is care. Our values are what we drive us, guides everything we do. So the word care stands for who we are, what we strive to achieve for everyone. So as you can see, C stands for courage, to do the right thing, to change, innovate, and grow. A, aspire to the highest degree of quality and safety. Our respect to value each individual coming from different culture, different background, and bring trust to every relationship. E, empathy, which is the essential requirement to give the kind of care we would want for our loved ones. So we didn't have a strong foundation if we could not work together as a team to provide top-notch healthcare to everyone, everywhere, every time. This is the reason it is also applies to our colleagues as well, the people we are working with. So I'm just going to talk about facilities include what we have. In our facilities, we have acute care hospitals, which includes tertiary, community, and rural facilities. Long-term care facilities, we also have community health services. We also serve for mental health and substance use services and public health. About Island Health, as you can see from this map, we distribute Island Health programs in 3 regions, such as South Island, Central Island, and North Island. As you can see from the slide, that the areas covers in Central Island, we have facilities there, as well as in North Island, Discovery Island, Gulf Islands, and also North Island. So I would like to introduce a video specifically for medical technologist positions that will emphasize what these position entails and what the professionals will look like when they are in this position.
analyze body fluids, tissue, and cells using.
Would you be able to see this video? Brianna, can you see the video?
Yes, yeah, we can.
Oh, okay, sure.
When a doctor orders a series of tests on a patient, it's the job of medical and clinical laboratory technologists and technicians to prepare and perform those tests to help detect diseases or abnormalities. These professionals analyze body fluids, tissue, and cells. Using powerful medical equipment, they look for bacteria, parasites, and abnormal cells. They also analyze cholesterol levels and cross-match blood samples for transfusions, documenting their results in reports or patient medical records. Since they regularly handle samples and medical instruments contaminated by infectious microbes, they wear protective goggles, gloves, and masks to minimize the risk of contagion. In larger labs and hospitals, technologists and technicians tend to specialize in areas like blood work or microbiology. Most work full-time. In general, technologists supervise the work of technicians. Technicians need an associate's degree in clinical laboratory science, and technologists need a bachelor's degree in medical technology or life sciences. Licensure is required in some states, and certification is often preferred by employers. The work can be stressful, especially when they must perform complex tests accurately and in a limited time. However, they gain satisfaction from knowing they've provided the vital information doctors need to save lives or cure diseases.
Okay, hope you enjoyed the video. So we're just gonna jump to more in detail of our medical laboratory assistant position. As we already discussed about this in the video, the Department of Laboratory Medicine, Pathology, and Medical Genetics is committed to enhancing patient care through the provision of consistently high-quality laboratory services. This also includes blood and other specimen collection, preparing samples for analysis, storage of samples, urinalysis, and electrocardiogram testing. So the qualification requirements, so there are essential education required for this position, such as grade 12 with successful completion of a recognized laboratory assistant education program, plus 1 year of recent experience or an equivalent qualification. Yes, you do require Class 5 driving license for this position, specifically purely because you will be commuting from one site. There may be from one site to the other, so hence why it does come under essential requirement. What we offer, so that's the most interesting part for our employees. So we offer competitive wage of $25.31, just the starting wage per hour. You also get 20 vacation days after your first year. We also offer 100% employer paid benefits, extended benefits as well. And shift premiums are from $1.45 per hour to $2.25 per hour, depending on your experience or number of hours you worked and the shifts. We also provide severance provisions at retirement, and definitely enormous amount of growth and development opportunities and sick leave. Now, next position I would like to talk about is medical laboratory technologist. As we know, and we saw in the video as well, it conducts medical laboratory tests, experiments, analysis to assist in the diagnosis, treatment, and prevention of disease. The potential candidate will be performing complex laboratory tests and analysis of human blood, urine, and other blood fluids, tissues, or substances to obtain data for diagnosis. The essential education requirement for this specific position is Canadian Society for Medical Laboratory Science certification. We would like you to have graduation from a recognized diploma program in medical laboratory technology, and also completion of core laboratory related courses within last 2 years or 1 year recent experience, related experience within the last 6 years in the core laboratory sections. Again, the interesting fact, what we offer for this position, competitive wages starting from $30.90 to $38.63 per hour. Again, based on the hours you have worked and based on the experience you are bringing on the table. So 20 vacations after your first year, 100% employer paid benefits, shift premiums, pension plan, severance provisions at retirement, and also accrual sick leave. So now I would like to my colleague Lucine. She will talk about more job application process in Island Health. Thank you, Lucy.
Thank you for being there. Okay, so we're going to start talking about the job application process within Island Health. As many of you may know that we have our careers link on the website, and you can create a profile there and start looking for jobs. If you're not within the laboratory technology area yet, you're also welcome to apply to other jobs within the island. We have many clerical jobs and other admin jobs that you could start applying and see how is the life within Island Health and working for us. And eventually, when you finish your studies, you are welcome to apply to our jobs opportunities there. Just going to the next slide.
Would you like me to check from my side?
I'm just going to share my screen. I think it'll be easier.
Okay.
Because I'm not being able to change to the next slide, sorry.
Right. Would you like me to change it for you, Lucy?
Sure, please, you can go ahead.
Sure.
So first, the application process. Everyone, when they apply for a job or they're interested in applying for a job, the first step to do is create their profile on our website. So there's a link there. We can also leave some information to you after the presentation. And next, so when you go to our public website, there are three places there where you can go, and you should be going to the public job postings where you'll be able to see all the positions available. On the left side, under the careers, there are more further explanation about how you can apply, opportunities associated with the organizations, also about Aboriginal employment. We have a recruitment team just for this population. We also have access how you can contact human resources, and even how you can contact the HR access team to help you to create your profile or with any questions that you may have. So you're going to click on the public job postings, and it's going to bring you to the next screen.
I think it's not letting me to go to the next screen.
You want to try again?
Yep. Yeah, it's just froze, I'm not sure. Yes.
There you go. So when you click on the public postings, you have two options there, create your account or log in via Hire. What you want to do is create your account if you don't have one already. And by creating this account, you're going to be able to provide all your information there and attach your most recent resume. You can also do a quick search before you create your account. So for example, you can search by locations and the category that you wanna search there, and then it's gonna bring you to the creation of your profile. So step one pretty much is all your information, your first name, last name, your address, and all sort of things that we can connect with you. On the second step, you can add there all the certifications that you may have. If you have medical terminology, there are a lot of clerical jobs that we require that. Your typing speed is also great for us to have access right away before we connect with you. Any other certificates that you might find valuable that could enrich your resume, you can add there as well. You can also have the option to add it to your profile. If you're applying to another job that's not within the same field, you have the option to add your profile there and attach all other certifications that you may find valuable and save there and just apply for that job specifically. And under step 3, you can just review your application that you want to apply for, or just review your profile creation just to make sure all the information is there. And even with the settings, sometimes when you copy and paste your resume there might not look great. So you might want to check there before you finalize your profile creation. So second step is the application process. Once you have your profile created, you can go ahead and start looking for job and doing your job search. So again, we're going back to one of the previous pages. You can click on the top left corner, job search. You can search the locations anywhere. You can also click on the laboratory services there. We have a category just for that. So it's going to be facilitating for you to find the jobs that you want. And you can just click and search. So sorry, could you go back for a minute?
Yeah, sure.
So if you wanna search for more than one category, for example, clerical and laboratory, just hold your control key and you can multi-selection location, job category, you name it. And you can click and search. Step 3 is the application process where it brings you to the jobs available. So for example, this is a list of the most recent laboratory technology jobs that we have posted on our website. And it gives you a glance of where the locations, what the type of vacancies we have. And you can just click on the job title and it's going to bring you to the full page to have a full description of the job that you want to apply to. So when you click there, you're going to have access, and also there is automatic setup. Once you do the search, you can save this search agent and you're going to be notified every time that there is a new job posting available. You're going to receive an email letting you know that you can apply for a new position there. So once you click on the job title, that's the screen that you receive. It's going to give you the more detailed information about the shift start time, which is very important. It will tell you if you are required to travel within the multi-sites. Sometimes you're going to be just working in a hospital, and sometimes you're going to be shifting within clinics or shifting within other hospitals. It's going to tell you how are going to be your days off. For example, that one, days off is rotating, so that means that there's no setting days that you're going to be having your days off. It could shift between 3 weeks or 4 weeks. It also tells you about the vacancy type. In this case, is a regular full-time job, and again, the salary range will be between $33.41 for this specific job, because it's a coordinator position. So just emphasizing here, this is for a team lead position, so there is a different rate there for this type of job position. So on the second, once you scroll down to the page, it's going to give you information about all the qualification requirements and also what you're going to be doing within the position. And then if you meet the job requirements, you can just click to apply. You're also welcome to send to a friend that you may know that will meet these qualifications as well, and you know that they're looking for a job. And now I will leave you to Parminder. She's going to share a little bit about tips and tricks, how to highlight your resume within your range of resumes that we receive every day.
Thank you, Lucienne. So yes, we're also going to talk about to maximize your chances of getting shortlisted for interview. It is critical to have a quality cover letter and resume. So hiring manager, do look at your application. As you all guys know that we get enormous amount of applications. So just to make sure you're strengthening your application with 4 key points, definitely mention in your resume or your cover letter. So always start with your summary of qualification. As you can see, these positions are especially self-centered for qualifications. So this is like a highly essential requirement. You want to make sure you highlight that information right at the beginning of your resume. Second thing is use chronological format. I would always use making sure that I am highlighting my most recent experience first. So such as you can see in the education requirements, that we do ask for your previous work experience in the specific field. And that will also highlight to the hiring manager straight away if you mention them right at your beginning on your first page of your resume. Third thing is use accomplishment statements in work history section. So in your work history, as you are mentioning about your job title, the company name, and the year you've been being with the company, and you also mention, please mention the detailed information of your job description. What have you done in your previous role, along with your accomplishments. So whatever achievements you have achieved in that role, please put them in bullet points. Use your cover letter to tell your story. As Lucienne also mentioned, that cover letter is the most crucial part for you to attract the attention of your employer. It will tell why this position is relevant to you, and please shine your passion in your cover letter. What skill set you can bring on the table for that position, and the passion is the most important thing mentioning in your cover letter, why we should hire you. So managers want to quickly be able to tell you if you meet the minimum qualifications listed in the job posting. So quick links and information. So if you require more information about Island Health or the position, please visit our website, www.islandhealth.ca careers. You may, if you have any human resources questions, by all means, please contact our friendly HR Access team. They have their helpline from Monday till Friday, 8 a.m. till 4 p.m. I've listed the phone number here as well as the email address. And if you have any personal questions in terms of about the position, or if you need any assistance in regards to the recruitment for the specific position, please do not hesitate to contact my colleague Lucianne Luthi at viha.ca, or you can email me, paminda.randawa@viha.ca. And we are here to help you. So I'm just going to pass over back to Lucianne as well as Anne, who are going to answer your questions if you have any. Thank you so much. It's lovely speaking to you all.
Thank you, Parminder. So we're just going to open up to questions that you may have, and it's going to help me. I'm going to be answering questions about via hire and also benefits within the positions in Island Health, and Anne is going to answer questions within regards to specifically to the professions.
If anyone has questions, they can just add it to the chat box that's right there, and then just to everyone if you put in. I have a question. So if I know there's various locations that you can apply to. So say if you get a position in Victoria, would in later on your career you want to move, is it easy to transition to a different location or different hospital? Or would you have to reapply to a position if it was open there? Or how does that process work if you want to relocate, or is that easy to do?
Sure, that's a great question, Brianna. Thank you. So yeah, so the easiest way is actually you have to apply to available positions within our website. And the reason for that is that the medical laboratory assistant position and the medical laboratory technologist positions, they abide by a collective agreement. So what does that mean is that we put seniority into consideration. So let's say you start with us and you are in a casual status, or you are even on a temporary position. You have to accrue hours for the medical laboratory assistant positions, the facilities. So the seniority goes by cumulated hours, and the medical lab is by health and science. So the seniority is by date. So as you accrue the hours there, you're going to apply to the posting internally, and we have to give first priority to the most senior applicant. Okay, but that doesn't mean that you're not also competing, because that most senior applicant has to meet the job requirements. And so the posting goes internally first, and they stay open for a few days. The managers, once it closes, the manager goes there and check the applicants. Let's say no one meets the requirements there, then the post will go public. And if you applied for that position and you meet the requirements and you the next person in line, you're gonna be contacted by one of our hiring managers, and they will award you the position. So then that will allow you to change to the location that you want. In terms of casual opportunities, you could be a casual in any of our locations. You could be located in the Central Island or North Island or South Island. So you could work in different locations, and you're just going to be accumulating your seniority there. But however, you're not going to own a line. So basically, going back to your your main question is, yeah, you can apply to any other locations, but the way it works, you're gonna have to reapply to our job postings internally.
Thank you for the explanation. We have a question from Mohammed. I think it's just a general question. they're wondering how, if they're a foreign trained RN awaiting for a credential evaluation, what can they apply for?
Oh, that's also great because I work with international recruitment, so I'm happy to see that question there. So, Mohammed, a lot of foreigner educated nurses, they come to Canada, and a lot of them, they're doing the bridge program, which you may know, it's an extension of their education that's required by the British Columbia College, which is called British Columbia College of Nurses and Midwives. And while they are within this process, they can apply to be a healthcare aide. Okay, so the school can give you information about that, how to go about it, but I can also send you a link. If you provide your personal email there, I can also send you a link about the BC Care Aid registry and how you can get this registered there, if it's for you or for a friend. So once you get the BC Care Aid registry, you can be working as healthcare aide while you wait for your RN license. That's what the most of the international educated nurses apply for. And yes, I can provide my email if you want to know more about the international recruitment. And we also hire international laboratory technologists at Island Health as well, as long as they are already certified. So it's just there for you.
Okay, we have another question that came in from James. They asked, on a similar note, I am a trained laboratory worker from the UK. However, they do not require phlebotomy for most lab positions. Is there any way to train for that so I can apply, or is there a way to find jobs that do not have that requirement?
And can you help me to answer this question?
Hi, thank you for your question, James. I am not aware of any program that only offers phlebotomy, but if you are like if you've gone through the certification process in Canada, there would be lab positions that don't require phlebotomy. In larger cities, we often will have medical lab assistants that do most of the blood collection, and medical lab technologists are doing the testing. So if you could give me a little bit more background on what your background is, that would be helpful.
Right. Let's see other questions here. Maybe if James wants to reply, maybe I'll ask another question. How has the COVID pandemic changed the role, if it has changed, either of the medical lab assistant or medical lab technologists?
Well, that's a good question. We are constantly dealing with change inside of the lab, and COVID has really made those that don't like change much more adaptable, because as the pandemic started, there was a lot of unknowns, and we have this COVID-19 webpage that I check daily, just so that you're up to date with what is happening. So that's kind of in a general sense. However, we use a lot of personal protective equipment when we're working with infectious samples. And at the beginning of every flu season, you have patients that come in with influenza-like illnesses. And so we're, very cautious when we're handling those samples. And so COVID was very much like that. For the medical lab assistants, they were wearing a lot of personal protective equipment with every collection during COVID. Whereas in the past, you would really only be wearing what you needed if you were going into a room where the patient was on isolation. But when we're collecting blood on a regular run-of-the-mill basis, we're always wearing gloves. And those gloves are changed between each patient. And then we would have on usually a lab coat or a gown, something to protect our clothing when we're collecting blood.
Great, thank you.
You're welcome.
Does anyone have any more questions? I can just plop it right in the chat box.
I'm just completing Mohammed's question. I'm just putting a link for you, Mohammed, how you can access the assessment for the healthcare aid registration for internationally educated nurses. Through the link, you can have more information about it and how you can go through this process to get your registry.
Yes, I just saw the message from Ahmed. I'll also give you my email address. And Brian, I believe you're going to distribute our team email address as well, talentacquisition@viha.ca. Our whole team is very passionate and we are always happy to help and assist all the applicants if they have any specific questions. So let me just type that.
All right, I guess if there's no more questions, I guess we can end the info session here. Oh, sorry, one more came in. Oh, that was just a follow-up. Okay, we'll just end it here. And yeah, if anyone has questions, they can email either Lucy or Parminder, and I will send out the recording at the very end. And then just a follow-up email if you're interested in Island Health or WorkBC services. Well, thank you again to the Island Health team for being here and presenting about the positions. Yeah.
And thank you so much for having us here. We really enjoyed it and we're excited and we are looking forward to have more applicants. And we already gave our contact details, so contact us if you have any questions.
Wonderful. All right, well, take care, everyone.
Thank you so much.
Thank you.
Take care.
Thank you.
Bye.
Bye.